Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner and a nurse educator. In today's video, we will be going over 5 prioritization delegation NCLEX questions. Nursing.com is an excellent resource if you are in nursing school. They have courses, cheat sheets, practice questions, study plans, sim clocks, have videos, and their courses and videos can guide you through nursing school so that you can consolidate studying and focus on what you really need to know. If you want to learn more about nursing.com, check out my affiliate link below. Number 1. A nurse is nearing the end of a shift which has been extremely busy with many client tasks. The nurse notes that the LPN and the nurse aide working on the unit are sitting around talking without offering to help. The nurse asks them why they are not helping, and they state that they were not given anything to do. Which response from the nurse is most appropriate? Say nothing and finish the work to go home for the day. Notify the charge nurse to carry out disciplinary measures. Consider the number of tasks that were delegated throughout their shift. Tell the staff members that it is their responsibility to ask what they can do. Back when I was a nurse, I was very non-confrontational, and I can't tell you how many times, and it was so demoralizing that as a nurse, and I'm not saying all techs are like this, there's some phenomenal techs, but I can't tell you how many times I was overworked to the point of being overwhelmed, and I would go into the linen closet to get some supplies, and there's a tech in there talking on the phone. The correct answer for this one is consider the number of tasks that were delegated throughout the shift. A nurse is responsible for delegating tasks. The nurse's colleagues, including unlicensed assistive personnel and licensed practical nurses, are responsible for helping with the work. Although the RN in this case may be angry that no one was helping, it is the nurse's responsibility to provide directions and tasks to delegate instead of completing everything without help. I think as women sometimes we struggle with this, with our husbands or whatever. It's like we want people to take initiative and to do things without us telling them. Or if you've asked someone to do something like 5 times, you get frustrated and you just end up doing it yourself. But in NCLEX world, everything is perfect. You're going to tell them what to do. They're going to do it. The nurse is caring for a client who has just returned from CT. The CT results confirmed a pulmonary embolism. The provider orders the following: initiate a heparin drip per the pulmonary embolism protocol. Labs PT, INR, PTT, CBC, NPO status, and activity as tolerated. Which order should the nurse implement first? The priority is getting these labs. That's the priority, right? Prior to initiating the heparin drip, baseline labs must first be obtained because the heparin drip will impact these labs. Once these baseline labs are obtained, then the drip can be initiated. This was a tricky question because in real life, you can draw the labs and tell the patient that they're NPO all at the same time, right? But what's first and what's going to kill this patient first is a pulmonary embolism. And we have to address that. And the quickest way to address that is by getting those labs so we can start the heparin drip. So that's why the labs are first, and then you would initiate the NPO status. The nurse is setting up an IV norepinephrine drip for a hypotensive client. The nurse has primed the tubing and turned on the pump. The pump is alarming, and the nurse cannot stop the alarm without turning off the entire pump. Which of the following actions is appropriate? Use the norepinephrine by gravity. Call biomedical engineering to fix the pump before using on the client. Program a new pump. Then tag and remove the defective pump from circulation for repair. If an IV pump does not work, it is essential that it is tagged appropriately and removed from circulation so that it can be fixed before using on another client. I would say, though, 9 times out of 10 in my experience, a pump is broken, for example, when it just won't turn on or the battery won't hold. Usually, if it's beeping incessantly, read the error message that it's telling you. Is it a distal occlusion, a proximal occlusion? Like most of the time, it just hasn't been primed correctly. So just IV backs, just make sure that this is a skill this was IV pumps when I was first starting nursing was what would take up so much of my time, like priming and make sure that you're flushing the patient's IV before you start, that you're priming the tubing correctly. It'll save you so much headache. The nurses on a busy unit are all needing help, so a nurse assistant is asked to assist them. Which of the following tasks should the nurse assign to the nursing assistant? Get a temperature and glucose on a client, teach a client how to adjust cooking techniques. No, they can't teach. They can't provide education. Administer insulin using the sliding scale. No. Get nutrition information for a newly diagnosed diabetes client. So they can get vitals. Nursing assistants are able to check vital signs and get blood glucose. They cannot do assessments. They can't pass medications or educate clients and or family members. The nice thing about nursing.com is that it has videos if you're struggling with a certain topic, and you can rewatch that topic and refresh yourself. The nurse enters the client's room with a baby aspirin to administer to the client. The nurse asks the client their name and date of birth, then checks the client's wristband. The nurse then tells the client this is a baby aspirin. It is used to thin the blood and prevent clots. The nurse scans the medication and the client into the computer. The nurse scans the medication and the client into the computer and checks that the name and strength of the drug matches the name and the strength of the drug on the computer order. The nurse hands the medication to the client. At this point, the nurse gets a phone call from the charge RN asking the nurse to come to the nurse's station immediately. The nurse says, "I will be back in a moment," and leaves the room. Which right of delegation has this nurse violated? Right route, because we didn't see this patient take the medication. This is correct because the nurse did not explain to the client how to take the drug. A baby aspirin must be chewed and swallowed, but without teaching from the nurse, the client may not take the medication the way it is intended. Thank you so much for watching. Make sure that you hit that like button and you smash that subscribe button. I currently have a goal of hitting 30,000 subscribers. I've been at this for 3 years and still haven't reached it. So it would mean a lot if you subscribed, and keep in mind that it doesn't cost you anything to subscribe and you can always unsubscribe later. Until next time.